Good morning. My name is Rawan. I'm a case manager calling from Ottawa Public Health. Can I please have your full name and your date of birth so I can confirm that I'm speaking to the right person? So when somebody tests positive for COVID-19, I am assigned to them. So I'm their case manager. I do teaching about how long to isolate for, how to isolate, so how to self-isolate, what the guidelines are, basically guide them on how to self-isolate from their family members. We really have to determine what their needs are, and we refer them to appropriate resources, all just to make their isolation period easier on them. So COVID-19 is still a fairly new virus, and our knowledge about it is evolving every single day. And based on that, our guidelines are changing pretty much all the time. So it can be any time from monthly to weekly to even daily, maybe a couple times a day. So it can be really challenging trying to keep up with all the different changing guidelines. Thank you. So the reason I'm calling today is because we received a positive test result for you for COVID-19. Were you aware of that? Taught myself, or I learned on the job how to not get overwhelmed and just to kind of keep evolving with the guidelines, with the knowledge. So when I have difficult conversations or difficult days at my job, I sometimes have to step back and take a minute. We do deal with, people in difficult situations, and we just have to kind of also learn to show that we're also human and that we're also people. And so I find that kind of putting myself in their shoes as well helps a lot to kind of give them time also to process, try my best to help them, provide them with resources, obviously, so that I find really helps, and also helps build that relationship with the client, who I just also met this morning most of the time. So they're probably like, who are you? So a lot of times I have friends or family members who will reach out to me and asking me about, numbers, guidelines, blah, blah, blah. And sometimes it just gets incredibly stressful to the point where I need to take a break from the news. I need to kind of put my phone away for a second and not look at the numbers, not look at how we're doing, because like you said, it's the numbers are a direct impact, or they are directly correlated with actions in the community and how people are doing in the community, but also there's no escaping it. It's my job. So if numbers are rising, we have to deal with it. We don't really have a choice, right? We have to come to work, and regardless of what the situation is in Ottawa, we have to come prepared, and we have to try our best to just cope with it and get through it, and we'll do it as a team. It's just sometimes it can be incredibly stressful, of course. There's no denying that. One of the most rewarding aspects or parts of my job is being able to connect with the Arabic-speaking community of Ottawa. وأنا بتصل النهاردة عشان نتيجة المسحة بتاعتك بتاعت COVID-19 طلعت إيجابية. I find that they're not only do they have to navigate COVID, they have to navigate more than just COVID. A lot of them are newcomers to the country. They don't have appropriate access to resources. So I find that by being able to connect with them in their language and my language, and being able to refer them to appropriate resources, that can be anything really, like mobile testing, getting food delivered to their houses, just being able to and even supplies, things that would help them out and help their families out throughout their isolation period, I find is incredibly rewarding. And they're usually very, very happy to have somebody on the line speaking Arabic to them. I find usually just brightens their day, and you can tell how happy they are on the phone. So my message to our community, to our Ottawa community, would be the importance of being cautious, because you can still get COVID again, and the risk is not going anywhere. So even just being cautious, being careful in our own individual actions, because they collectively affect our community. They dictate how we do in terms of numbers, how we do in terms of infection rates, and that reflects how we're doing as a community, but also that also affects the guidelines. So it's all interconnected, and it all falls back on our actions. It's not only to protect ourselves, but also to protect the people that we love, our friends, our family, and our community. It's so crazy to think about that we've been in this for a year, and we've been doing this for a year. And we know the community is tired, and we know the residents are tired, but we're also tired. So it's been a very, very long time. We need to not lose sight of the end, and the end will come, and we'll gather again, hopefully in time. But we need to stay consistent, and we need to not, never lose that hope of gathering again with our loved ones, going out in the community, all that good stuff. I mean, that's what we all want. That's the end goal. We all have the same end goal. Thank you. you for taking the time to speak with me today. You have my phone number. If you have any questions or concerns, please leave us a message. And we will chat tomorrow for your daily monitoring call. Have a good day.